All this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So we will talk about the Europe, Middle East, Asia, and Africa today. One concern that I have is the cases in India. Of course, the same situation in Brazil as well, but Brazil probably a little more concerning. So let's look at these cases. And a cool bean, her name is Dr. Asia Zadi, if I'm recalling it correctly. She sent me a link yesterday, which has the state-wise numbers and charts for India. So I think that is very, very useful. Thank you very much to Dr. Zadi. And she is part of the FLCCC as well. And she is a COVID researcher too. So thank you very much for this. So let's look at the data. So this is drbeen.com. Here we have, we always start with Israel's numbers because Israel has led the world in vaccination, although now there are many other countries that are almost 100% as well. So see here, the number of cases have really dropped, which is good. I am just looking forward to the time when this would become zero. So that is one. I hope it becomes zero. I know some of you would think, would it ever become zero? And then here are the daily deaths as well, and they have reduced too. Consider this, that 93 daily deaths, for example, here, and then here 3. So still every death is a death, it's a tragedy, but here we have a reduction. So very good job on Israel's part. Here is UK. UK has taken the route of vaccination with single dose plus lockdowns. And please don't mind, both of my cats are here and they are fighting with each other or playing with each other. So here, daily new cases in UK. So they are going down as well, but it looks like they kind of are slowly now reducing, but not very fast. Still, look at the numbers here and look at the numbers here. And when you look at India, please observe a similar thing. First, small wave, then a second broader wave, and then a third rapidly escalating wave. And that rapid escalation is, of course, because of the variant that can go out or can infect fast. And then on top of that, in case of UK, it was the Christmas and it was the New Year. And actually before them, the preparations and people were out, Cool Beans told me. So similarly in India, the Kumbh Mela and the Holi and the votings, elections, and so on. So there is, you'll see a pattern that is similar. And then this is the active number of cases in UK, and I am sure that the deaths are following that trend as well, so they are reducing. So good job on UK's part as well. Here is the Bloomberg's current situation with the vaccination. This is interesting for me that about 1 billion people have been vaccinated. So 832 million doses have been administered. So that is a very large number that has been done. And once again, please, if you hear these sounds of running, this is Luffy and Kyrie playing. And then here, this is an interesting number that I thought was interesting. COVID rates have flattened, not reduced to zero, have flattened or declined in the 4 places where enough vaccines have been given to cover at least 40% of the population. So that is what Bloomberg's folks have observed, that if the population is 40% vaccinated, then the numbers become flat. So that means the R naught, in scientific terms, we'll say that the R naught has become 1. That means one person only gives infection to one more person and not more than one. Ideally, we are hoping that the R naught would start going below 1 and the infection will start getting eradicated. So here are some of these numbers. If I go to UK, just to see there, so see here, 48.4% first dose and 12.2% second dose. And if you see here at the top, Gibraltar, 104% first dose, second dose 88.1%. Israel, 59% first dose, excellent, and then second dose 54%. What is interesting for me is that Israel's two dose and ramp up to 54% versus UK's single dose and ramping up on single dose almost have similar results. And again, I realize that this is not just the vaccination, it is in addition to the vaccination, the people's behavior, social distancing, masks, and many other factors. So, considering that those factors are also in play, it is still very interesting that both countries took a slightly different approach, but the results are very similar. So, that means single doses can work very well as well. And now here is India. And this is what I was hoping that we see. So they don't have that tiny, small first wave. So this is their first wave. And then this second wave is just as we saw with UK, that this is a large uptick. The reason I'm kind of making it similar to UK is that my hope is that then it would decline that fast as well. However, UK had it declined with the help of vaccination. India has a large scale to cover with vaccination, 1.38 billion people. So they would have to do more than vaccination. They'll have to figure out some drugs, for example, ivermectin like things, or they'll have to have social distancing, masking, and so on. So there will have to be some more complementary factors here. Now, this is what I wanted to show you. This is what Dr. Zaidi sent. So this all of these links are present in the description. So if you wanted to see what their link is and then go and review it by yourself, you can. So this is covid19india.org. And if you see here, this is really beautiful. You can actually click on a state, and then you can click on the number here, or sorry, this yellow tab here, button here, and that would open that state. And then you can see the state-wide numbers. This is what I was trying to figure out, that do we have somewhere charts that show trends of the cases? So if you see here, the trends are going upwards. So let's go back to this one. The one interesting thing, and I come from Pakistan, so similar thing here, and that is how the numbers are written. So in the Western society, we are used to putting a comma after every 3 digits. But in India and Pakistan, the first 3 digits have a comma and then 2 digits after that, because the numbers are broken down that way. So the first 3 digits are thousands. And then the next 2 digits, we say lakh, which is 100,000s. And then the next 2 digits, we call them crore, which is 100,000s. Or something like that. So if you see here, this 1.1 CR, this CR stands for crore. So this is how the numbers are written. So let's go back to the states for a second. This is Maharashtra. And if you see, Maharashtra has been hit the hardest. If you see that number over here as well, 36.39 million, let's see, now 3 million cases. So 3 million cases. And then Uttar Pradesh is under 7, so about 766,000 cases. And we were thinking that Uttar Pradesh is using ivermectin, and because of that, they have better cases. I haven't yet seen any good article that says what is the behavior from the healthcare authorities in these states. I could find just one ivermectin usage, and we have actually discussed this in the past. And that was the prophylaxis ivermectin study in India, where they had used 300 microgram per kilogram with a gap of 72 hours, with 73% reduction of SARS-CoV-2. So this was a prophylaxis study they did, and we talked about it. I haven't yet seen any article that shows how ivermectin is being used or not used and the effect of it. This is Uttar Pradesh. This is the state where we thought that they were using more ivermectins. Generally, if you see, they do have an uptick, but that is rather more flat compared to a spike. Here, this is also flat-ish, but moving upwards. So India is not doing that well. If you go down here, active cases now at this time 1.36 million, and then number of deaths are following that as well. This was the role of ivermectin in India. This was one of the studies. Then here is another news. It's an older news. This is South Africa. Regulators under pressure as illegal use of ivermectin to treat COVID-19 sores. So this was, I believe, Feb 5. So it's an old news. We are in March, April timeframe. Almost April done as well. So this was that they were actually arresting. The South African police have arrested 6 people in the past 2 weeks for trying to smuggle large quantities of the antiparasitic medicine. So here is that, which was sad. And why I brought this up is that down here they talk about Dr. Andrew Hill from University of Liverpool, who has been researching ivermectin for United States and the World Health Organization, and representative from the frontline COVID-19 Critical Care Alliance, that is Dr. Paul Marek and Dr. Corey, presented at the NIH with data from 18 randomized controlled trials involving over 2,100 patients, ranging from, so now check out this sentence structure, ranging from a 400% 5-day Egyptian study to 24% 1-day study. So if you can see this article, whoever is writing it, you can see their leaning from the way they write, that they are generally not in favor of this. So then they talk about small studies, and this is what is happening. I think that there is a lot of damage done by the consultations to WHO by some of the folks who think that ivermectin is not good. So I wanted to see some more as well. So this is Brazil. Brazil is not doing good. And the other thing is that the rate of infection in children is increasing as well. And the reason for that, so far, we'll see when some studies come out. So far, it does not look like that the reason is that somehow the virus is targeting children more. It is just that the number of infections are so much that a larger number of children are exposed as well. And we know that there are some children who would get infected. So there are children who are dying as well now on ventilators, and a greater number. The other thing is that in children, the signs and symptoms of COVID are not like adults. So they don't start with cough or upper respiratory infections. Many times children actually present with diarrhea or abdominal discomfort or just loss of appetite. They just stop eating. And so that very many times escapes a doctor's notice that this may be COVID. And so there are many stories that I was reading in various articles that children who didn't present with COVID symptoms were missed by doctors as COVID, and they said, hey, this is some GIT issue, don't worry, go home. And then the children died. So that is a tragedy. So if you are a medico, please realize that in the pandemic, whenever you see a patient, one of the prevalent thought in your mind should be they may have COVID, even when the symptoms are not exactly as you may suspect for COVID. This is Bulgaria. I had heard that Bulgaria was using ivermectin, so I always kind of look at that, and here we are with Bulgaria, and looks like they are trending downwards, but we'll continue to see. So with this data I wanted to share, let's have our questions and discuss them. So how is everyone doing this morning? Doug says sees like heroin. Yeah, so that is what, and people arrested. Bob says, I think Bihar and West Bengal are also using ivermectin. So let's see if we can. I'm not very much up with India's geography, so please don't mind. Let's see. West Bengal. West Bengal is 600,000 cases. The question is, what is their population? So if Dr. Asia is listening, I think we need population for the state here as well, because that tells you what is happening with the cases. But let's say if we look at West Bengal's trends. Hey, Luffy. So the trends are sort of flat. Active cases are generally going upwards. So these are confirmed cases. We should look at this one. So active cases are going up. How was the active cases in Maharashtra? They're going up as well. And then Active cases in Uttar Pradesh are going up fast as well. So you said that West Bengal is using it and then Bihar is using it. What is Bihar's population? So Bihar, wow, they have a lot of active cases going up. So we need a little more digging to do to understand this. Okay, so Richard John says Turkey are in a bit of a trouble with the rise in cases. Do you know if they are using Mr. Ivy Man? Let's see. Or Ivermectin. Let's look at Turkey. I thought they were, but I do not know if in current days. And I have very good cool bean doctor friends there, so I would ask them. Oh wow. So this is a similar pattern: a small wave, then a slightly broader wave, and then a rapidly escalating wave. And I think the rapidly escalating wave is because the new variants are getting in various countries. Oh, look at this, active cases. This is not good. And of course, the deaths are following that. So yes, Turkey is not doing good. I can't understand that why organizations like WHO not come to this conclusion to say, well, this looks like ivermectin may be useful, so let's not approve it, but let's do what NIH did. NIH said, we are not for ivermectin, but we are not against it either. So if WHO had come out and just said that much, they would have at least allowed some of the doctors and other countries to continue to experiment and try it. I have become whiny about WHO's situation. The thing is, anyways, GB. The situation in India is very bad, and there is very laxity among the common people and administration. Studies say that we are going to 5 lakhs per day. So 5 lakhs per day, 500,000 per day. That is a very large number. That is a very similar number that US has been having. So it seems like people had become a little more comfortable that, hey, it is gone from here. And that has caused maybe, as you're saying, laxity in the behavior, and that is causing it. Wish them well. I still believe in hydroxy, zinc, iver, vitamin D's, vitamin C's, those things. I still believe in them. I think I'm going to get my channel banned by continuing to talk about them. Prachit says, Dr. Bean, Maharashtra, Kerala, and Delhi are the only state which is showing COVID data transparently. Uttar Pradesh, Gujarat, etc. are hiding their COVID numbers. Very interesting. And Prachit, what would be the reason? Is this political or economic or something else? Ayush says, Maharashtra, massive underreporting. Prachit. Okay, so you guys are talking with each other as well. I need some cool bean from India who has a better understanding of India's numbers to join me to discuss this, because India is not doing good, but we have to figure out why not. Because India had used hydroxy, India had used ivermectin, why is this not working, or does it not work? So we need to look at that together. I need some more education about India's numbers and management processes there. Rajul says, in India, many cases are coming where RT-PCR is negative, but CT scan shows positive. Is COVID-19 virus direct going into the lungs? No, so I have seen this as well, that some folks are saying that the chest CT scans are positive, and this is what is the asymptomatic situation, where the patient does not have any symptoms in the upper respiratory areas, not even the lower, and they're not coughing, they do not have fever, but they still go through this and recover. Now, this will be interesting. And honestly, this is the right behavior of a viral pneumonia, where a person is not even aware that I have pneumonia. This is called walking pneumonia. So if you would like to do this quick Google search or DuckDuckGo search, actually France had said DuckDuckGo. So let's try DuckDuckGo today. If we go to DuckDuckGo and we say um, walking pneumonia, so walking pneumonia is, see, walking pneumonia symptoms, causes, and treatment. The reason I bring those things up is to make sure that you are aware that these things are, science is already there, because there are so many doctors nowadays just making up sciences and just speaking them, and there is no way to figure out who is right or wrong. So then at least one way to figure out is to go and see what they're saying is possible. So here, walking pneumonia is a quality of viral pneumonia. And what happens is, if I can draw this, I'm going to take this comment off. Puya, hello, how are you? So let's look at this for a second. What happens is, usually, again, SARS-CoV-2 did not do this. It broke all the rules. But usually what happens is, imagine this is an alveolus. Alveolus is, so if this was the respiratory system, the respiratory tree, as we say, the pipe, respiratory pipe, it continues to break down into smaller and smaller branches till the time that it becomes so thin. When it, every time it divides, it continues to become thin and small. So finally it has these areas where the oxygenation is, or the gas exchange is occurring. So I have this one here called an alveolus. So now what happens is, this is an alveolus. Outside of the alveolus is a blood capillary, and between them is connective tissue. So here we have connective tissue. So what is happening is, oxygen is going this way into the blood, and carbon dioxide is coming out back into the alveolar space, from where the carbon dioxide would get out and oxygen would then travel to various tissues. Viruses usually cause infection predominantly in the interstitial area. And because of that, the general behavior of the person is they don't even know I have an infection. This does not cause cough, because for coughing, one reason that the cough occurs is when the debris or damaged tissue occurs in the airways and we try to clear it, or when the nerves get irritated, which are on the superficial areas, and we try to cough to kind of calm them down, or that irritation causes coughing. So when the interstitial area becomes infected, that usually does not cause cough. And what happens is, the patient is just walking around and they have pneumonia, and you do their chest x-ray and you say, oh man, you got pneumonia, while they don't even know it. So this behavior of the virus to create ground glass appearance but have not a lot of symptoms is a usual viral behavior. This virus had such a weird behavior in the beginning. I think it's mutations and these behaviors are changing. In the beginning, remember what it would do is cause upper respiratory infection, then it would go to the lower respiratory area, then it would cause the interstitial pneumonia, then it would cause so much destruction that it would break the alveoli and the blood vessels, and now it would become a normal pneumonia, which is usually bacterial pneumonia. And then the phases of the pneumonia would occur as well, which are, if there are medicos over here, which are the red hepatization, gray hepatization, resolution, or organization, etc. I've talked about those in the past. So to your question again, it is possible that some people are actually getting walking pneumonia from this, which is entirely possible. And then they would show imaging to having an issue, but they would not show symptoms. Jem says, Dr. Bean, are there other examples of natural viruses that break all of the rules? I have been wondering the behavior of SARS-CoV-2 in normal, with notwithstanding the variants and mutations. So, Gems, no, I have not been aware of some other natural virus. I think you have put the word natural for a specific reason. You probably are alluding that this may not be a natural virus. So I can't say it is natural or not. But I have not seen other viruses that break so many rules. For example, this virus breaks a rule of not sitting up here in the oropharyngeal area, and it goes down in the body as well. So that is the rule change, is that coronaviruses usually like to stay in cooler areas of the body. So they live in oropharyngeal area, and if they cause some disease, they would cause upper respiratory tract infections, which we would call common cold. This virus can actually replicate at the warmer temperatures. So that means it goes down in the lungs, and then it goes down in the body. Anywhere it can go and replicate. The reason for this, we say, is because it came from animals, and in the animals it had learned to live at warmer temperatures. Because of that, it does it. So again, is it natural or not natural? But the reasoning, I'll give you what we have been hearing. The second part, the second rule change, is that it combines with ACE2 instead of the DPP4 or other receptors. So this is a new receptor that it has chosen. So once again, was this an evolution in the animals that it learned to work with ACE2? And so this is one coronavirus that works with ACE2. Third thing is that this virus is so intense, so infectious, so contagious, that you are seeing that it is just zipping around in the societies, that we have not seen with other viruses that fast. Then next thing, whatever number is, fourth or fifth, I think fourth, is that it can show viral pneumonia, which is the walking pneumonia, but from there it actually becomes bacterial pneumonia-like and causes extensive damage to the point of then reaching the ARDS and cytokine storms. And then this is another virus, which another property is for this to cause immune system to become so much triggered that cytokine storms occur and the people die. That also is very unique to this. So there are so many properties of this virus that is just very unique. And the reasons, one of the reasons that it is zipping through society so fast is that we never had it before. So that is a reason. Then it causes that destruction, which causes cytokine storm. I have no idea why does it do it and in whom does it do it, but it does have that propensity as well. So yes, this is a virus with lots of rules broken. Friandis says, Vanilla Bean here, PCR very hard to get here. Been feeling under the weather since a week. Don't know what's wrong. Heavy neck, blood pressure 10667, very low grade fever, but nothing else. Could it be COVID? So as I've said just now as well, whenever we are in a pandemic and we have pandemic related things, for example, if somebody comes in and they have bleeding from their foot, we will not say that this is COVID. But if somebody has respiratory issues or low grade fever, which is a viral infections indication, then you have to include the pandemic related or outbreak related disease in this as well. So if I would be the one, I would actually rule in COVID-19 too until it is ruled out, and then I'll manage it accordingly. I did that for my own case as well. When I became sick with maybe COVID or common cold, when I got tested, PCR was negative, antibodies were negative. So I think it was not COVID. I had been taking prophylaxis as well. But all those common cold-like things that I had, I suspected it was COVID. All of the doctors who were managing me, so thanks to all those cool bean doctors, there were more than one who just started helping. They also said that we'll rule in as COVID. So I hope that answers this question, that one has to rule in COVID when the outbreak is going on. Nick says, like this video and help Dr. Bean. Thank you very much. Ali G says, question, can someone delay the second dose of Sinopharm vaccine more than 21 days because situation is not good in Pakistan, roads are blocked? I think so, yes. There is no, actually delaying helps improve the outcome. And I know that there are folks who have actually not had the second dose and their response was fine as well. What is going on with Pakistan? Let's see. How are Pakistan's cases? So Pakistan also has a third wave which escalated fast. Seems like it is being controlled, but still they have a third wave. Active cases have gone up. So this is their second biggest wave. So this was first wave, 108,000, for example, currently infected. Then at their peak 53,000, and here they've already gone to 75,000. So almost becoming like the first wave, and deaths are following that as well. Today, my one of my class fellows, we have a WhatsApp group for our class fellows, and he sent this note that, hey, for the first time in my own immediate family, my family, I have two COVID related deaths. So this is happening because of the people being less careful and the variants zipping through faster. Khushali says, does all these vaccines protect against the current variant spreading in India? Data shows that as the number of vaccinations are increasing, the number of cases are also increasing. So, Khushali, this is a very important question, and we have to understand the answer to this one. We saw this with Israel as well. As the vaccination was increasing, their cases kept increasing as well at a regular pace. And people said vaccines are causing the cases to increase. And then we talked about this study a few days ago where they had said that the increased breakthrough, this is an Israeli study, correct? Increased breakthrough of B135. So that was the South African variant, breakthrough within a window of 7 days after Pfizer to 14 days after Pfizer's second dose. What they also showed, which was not taken up by journalists and media because that was not useful for them, what they also showed was that after the first dose, the chances of infection were more prevalent with B117, the UK variant, than B135. So the chances are still there. And this is, they had even postulated in their discussion, and I showed it in my video, that they had said maybe this was the reason that while we were vaccinating, there was an increase in number of cases. So now that they have vaccinated more than about 55%, and now they're seeing very low number of cases, the important thing is that they looked at they vaccinated the vulnerable population first. That started reducing their cases. So here, Khushali, I don't think that it is that vaccine is somehow related to increased cases. It is just that there is not enough vaccination. So if you look at India's vaccination, India is way low yet. So let's see. Where is India? India. Where is India? So 1 second, please. Israel, Bahrain, Hungary, UK, Iceland. Okay, so show all. Sweden. Here. So India, first dose 7.3% and two doses 1%. It is nothing given in the population. So one can say that, hey, India has given 114 million doses. But look at the population as well, 1.38 billion people. So this is nothing. So there is no correlation. The vaccine hasn't even reached a point to be effective. What I hope is happening is that the older folks are becoming vaccinated first, so they are protected, and then others. Chandra Sekhar Bura says, Dr. Bean, is there a possibility of COVID transmitted through food such as cakes, ice creams, or liquids? Please shed some light. So the general answer is no. But a more detailed answer is this, that SARS-CoV-2 loves to live in wet environments. So because of that, anything that is moist can have SARS-CoV-2 live in it. However, we also know that when we have a small particle, which is made up of, let's say, lipids, and then you put that in some moist environment, there is going to be a balance between the ions present outside and the ions present inside, and that would either shrink it or swell it, and it would burst or live, depends upon the moisture as well. So it can live longer in the moisture, but it has not been seen to survive better on foods and other things. I think that is just because of the environment of the food, the alkalinity and the acidity and all those extra electrolytes that are present with food, they kind of rupture it. Plus, if the foods are frozen, or if they were cool, or they were cooked, that also kills it too. So usually foods have not been seen to transmit this. Rahul says, can we start budesonide on first day of COVID with ivermectin? So the what I have heard from I have never used budesonide in my patient, but what I have heard is that it has been working very well. I did a study discussion yesterday as well from UK, where the doctor had done, or the doctors had done this research from within 7 days of the symptoms. So I think it can be used, but still, I haven't seen any study that says from day one. I would think that as a doctor, somebody would say, when I receive the patient with symptoms, can I start them on budesonide? So I think when they receive a patient with symptoms, it is already 3-4 days of incubation and then 1 day or 2 days of the symptoms. This may be okay. Budesonide in the respiratory area is not a problem. So if I felt that my patient was developing respiratory concern, I would put them on it. But I haven't seen any data or studies yet for the first day usage. Dacha G says, what is the general opinion on a dose and time that long haulers should take for ivermectin? So I had done a discussion about this. There is another video on a different channel, but from me, you can actually see ivermectin dose, Dr. Mobeen Sayed, or Mobeen Sayed, and you can see it. The usual FLCCC says full dose, I believe, bi-weekly. I do full dose weekly. So now, for the long haulers, I do a full dose weekly as well. Vikram says, if a patient is having fever, can they take vaccine? So the fever means that they already have some infection going on. Usually that is what it means. Fever can be by other reasons too. So I would suggest that you talk with your doctor and first have the fever come down before the vaccine. Now, if the fever itself is because of COVID, then giving vaccine during COVID is of no purpose, because COVID itself is the biggest vaccine one can get. Then I think the management approach is how to save the patient and protect them more than how to vaccinate them. GB says, please explore antibody-dependent disease enhancement. We are seeing it in India in a few cases. I have done a detailed discussion about that. I have discussed 5 mechanisms of it, their possibility, their chances, the studies that show when they can be possible and not. So already done. Aruj says, what about transmission via surfaces, Dr. Bean? Should we continue to keep wiping surfaces? Yes. So the surfaces, again, are of 2 types. And I have been drawing this for some time, so let me very quickly answer this one too. What happens is, this is a virus that has a lipid layer on it, correct? And that means it has fluids in it. It has fluid in it, and it has to keep those fluids available to it. Otherwise, it would become invalid. It would not work anymore. So what happens is, now it depends upon what surface you have. If you have a surface, for example, that has a lot of fluid on it, for example, it's a moist surface. It is a kitchen area where the surfaces are moist, or it is an outdoor surface area where some rain has occurred and the surface is wet, or the roadside, whatever. If the surface is wet, the virus can live in it for a longer period of time. On the other hand, if the surface is not wet, or the environment is not moist, then the virus is going to become shriveled and shrunk quickly and become inactivated in 3-4 hours. And the reason for inactivation is that once the water gets out of the virus, and the virus kind of becomes this really shriveled, shrunk thing, the RNA inside starts breaking down as well. And that RNA breakdown would cause the virus to become invalid. So that is the second possibility. Third possibility is that maybe the surface of the environment may be moist, but the surface has pores in it. For example, cardboard boxes or paper or those things that they have microscopic pores. These porous surfaces also pull the moisture from the virus. It is just that if you have, for example, paper towels, so if you have your hands wet and you put them on a porous surface, you would see that that would absorb your water, the water from the surface. Same thing is here for the virus as well, that when you put the virus on a porous surface, the surface is going to pull the water out of it and make it invalid. So that is the kind of issue that occurs with the virus. So this should give you an idea for what kind of surface can be used. Susie Smith says, "Hi, Dr. Bean. Thank you so much for all your endeavors from UK." Thank you very much, and stay safe and protected in UK. UK is doing good nowadays. I'm happy. Rahul says, question, ivermectin with colchicine in early treatment. So people have used colchicine with lots of success as well. And I have done a video about it. So if you wanted to see the studies and see how to use it, I've done a discussion. Jeffrey says, clarify long haul. Do you mean they should take ivermectin for how many weeks, and do you mean once a weekly? So once weekly till they feel better. That is what people have been doing. And again, there is a concern for long-time use, but I think people have been using it for some time, so it may be okay, but everyone has to figure out how it suits them and talk with their doctor and work with their doctor. But keep taking for some time till you start recovering. What I have seen for long haulers, so far the reports for long haulers, and I repeat it every time just so that maybe it can help some folks. And I said a few days ago, I should make a separate video about this. My apologies. So for long haulers, the things that people have reported that worked, and this means everyone is different and their mechanisms are different. Interferon, the Cool Bean said that interferon usage magically made my long haul symptoms disappear. So that she actually kept asking me that, hey, why don't you talk about interferons? And somehow then, so that is one. Then long hauler tinnitus. I have seen that there are both reports. On one side, there are folks who say that when I took fluvoxamine, it really helped. And then I have a nurse practitioner, Cool Bean from New York, who said I took fluvoxamine and it increased my situation of tinnitus. And so then they said they started taking antihistamine. So antihistamine helping with the long hauler as well. And he said my tinnitus has improved a lot. So this is another set of drugs that in some have become very useful, in others did not. And then in others, antihistamine worked. Then ivermectin weekly, full dose, has been seen to be very, very efficacious. What I have seen is, or got in the comments is that if they leave ivermectin, then the symptoms bounce back. My thinking is they just have to continue for a little longer period of time. And then, of course, we have steroids as well. I have used steroids in my patients and they have not been long haulers, or the ones too who were long haulers, they recovered very fast. So steroid, low dose therapy with oral steroids have been very useful as well. So these are the things that have been seen in long haulers that have helped. And I would continue to add more as people report them. GB says, colchicine working magically if given in early stage. Colchicine has seen to be very useful as well. Yes. Fran says, Yoga Bean, UK here, welcome. So would virus live longer, stronger in humid countries, seasons, or environments, also because it is airborne aerosol, hence mask may help or not? So I have done detailed discussions about this. The humidity and the relationship with the spread is interesting. One has to have a right balance of humidity. The reason is that if it is too moist, then the air does not propel for a longer distance. And so the virus and the air from the breath cannot go too far. So too moist would not work. Too little moisture will cause the virus to start drying up very quickly and either becoming inactivated or becoming aerosol, again, depending upon how much is the lack of moisture and what is the temperature. If it becomes aerosol, then it can infect people for hours, even when somebody has left. And if it becomes inactivated, then it is done. Then if it is right moisture, another amount of moisture, so normally it should be kept within 40 to 60-ish. So right moisture can actually start adding moisture on the surface of the virus, and it would become heavy and it would drop. So that means just saying more moisture or less moisture is not the right term. Less moisture would definitely help. Having said that, when you connect it to the masks and aerosol, the thing is this: mask, if worn properly, where the mask itself is not so thick that all the breathing is happening from the leaks, but majority of the breathing is occurring from the mask itself, then the mask itself can handle virus and the aerosol size as well. That is what the surgical masks are made for. So I don't think that the mask would become invalid. Aruj says, how long do we have to wait before entering a room with the windows open, with little window before we can enter, little wind before we can enter the room again if there's someone suspected of COVID was there? So the WHO, unfortunately, the disliked organization, at least I don't like them. WHO has said that the exposure time is 15 minutes in a closed place. For example, a doctor's clinic where patients may be sitting, and then another person comes in and they are exposed to that person for 15 minutes, can be enough viral load received to have the infection. So if the windows are open and if there is little wind, but still they're open and I'm sure there is some circulation, then the protection becomes more. I cannot tell you exactly how much time. Aruj. Yes. Blitzer says, how do you comment on reduced infections in Texas and Mississippi? Does this also mean mask mandates never worked? Don't know about that. I'll have to, just like with India, I can only conjecture that, hey, this is what's happening. So without looking at the reasons and data, I cannot just comment and say mask did not work or social distancing did not work. In the beginning of my lectures, I had early on a year ago, I had said that 80% of the cases are where patients recover automatically. And now we can say whatever they were doing is what is working. Khushali says, can a vaccinated person donate plasma for COVID patients? Is there any difference between antibodies produced for vaccine and COVID? Not a lot of difference. So, or actually lots of difference. The COVID infection would create antibodies, which are tons of types, which are many types, and against various parts of the virus. The vaccinated person would create antibodies that are only against the spike protein. So they are very specific. So can we use them? Sure, we can use them. But why not give them? Oh, okay, so you're talking about somebody who's sick. So yes, can be used. Rui says, thank you, Drbeen, and thank you very much for the super chat. You're very welcome. Once again, Froyandis' question, Vanilla Bean, is it okay to combine low-dose aspirin and ivermectin? So ivermectin has been seen to increase the bleeding tendency by reducing the metabolism of warfarin-like drugs. I do not know its interaction with the ivermectin. So the best thing to do is to go to drugs.com, open up the drug interaction, and just put these two drugs, and they would tell you if there is any interaction. I actually use it with aspirin as well. So for example, nowadays, after the vaccination, I had some aches and pains, and I was taking aspirin, plus I was taking ivermectin as well. Jessica says, why is it that countries using ivermectin are still experiencing increasing death rates like Pakistan, India, and Brazil? I think that is because of the consistency. For example, for Pakistan, I know they're not consistent. There are some doctors who are very consistent with it. They like it and they have very good success rate. And then there are some doctors who say FDA said no, or nowadays WHO said no. So it really, I think, is the problem with the consistency. And the consistency problem comes from the problem with the leadership. When WHO or FDA or CDCs or those organizations come out and say, we don't think it should be used, then doctors use that and say it should not be used. And please remember that humans like to absolve themselves of decision making. Because it's not the decision making that is difficult, we like to avoid the consequences or responsibility of the decision. So it is easier to just say, hey, WHO said no, I'm not going to use it, than to say, I'm going to become brave enough to try to use it and see what happens. And if it works, I'll continue to use it. And I'll talk with my patient. And so all ethical things. And ivermectin is pretty safe. It is approved. It is safe. It is one of the essential drugs in the WHO. So it's not a poison within the therapeutic doses. Outside of therapeutic dose, everything is a poison. Everything is actually a poison, but within therapeutic dose, it is useful. So having said that, the consistency is because of lack of leadership. Actually, not lack of leadership being negative. Rahul says, what is your experience with ivermectin in terms of mortality? So Rahul, I don't want to jinx my own situation. In my practice till to date, I have no one die who I started working with from the beginning. There have been a couple of cases where I was asked to come in when the patient was almost in both of cases, patients were already in ICU and were on oxygen. And then I was brought in one case, we could somehow, actually 3 such cases. So one case was here in California. They did not agree on ivermectin. Unfortunately, the person died. The other case was in Pakistan. They also had a lot of hard time agreeing to give ivermectin, but when they did, patient bounced back for a couple of days and then they died. And the third case was in Dubai. Again, the patient was already on oxygen with 80, 76 oxygen levels. And I asked if we could start ivermectin. They simply refused. Dubai does not use ivermectin. So they said not at all. And yesterday I got the news that she passed away. So far, everyone who I had started from the beginning, fortunately, luckily, they have all been fine. But there have been 3 cases where I was brought in a little late and they did not make it, unfortunately. So Nick says, yes, absolve themselves of personal responsibility like in Nazi Germany. History repeats itself. It's just so shameful at this time because people are dying. Khushali says, so let's do one more question and then we break. I have my next meeting starting in 5 minutes. So Khushali says, on day 1, should a COVID positive patient be started on a cocktail of ivermectin, doxycycline, methylene blue, sublingual? I would remove doxy for the time being. Sorry, yes, I thought dexamethasone, sorry, to decrease chances of hospital. Yes, absolutely. Absolutely. So thank you very much for your time today. I would see you this evening, some of you and others tomorrow. If you have any more information about India, Brazil, or other places, usage of ivermectin or not, please share that with me. Having said that, please like, subscribe, and share this video. And if you would like to support this work, there are 3 links in the description. One is to buy me coffees. You can buy me coffees without PayPal, so that is kind of to avoid the PayPal. Other one is to become a patron, and then one more link is to support this work via PayPal. So thank you very much, and I would see you this evening or tomorrow. You're very welcome, Margaret.